Some people would tell me stories about how just as they got sick, the insurance company would have gone through their form and saw some innocuous mistake and just dropped their coverage because they hadn't listed. In some extreme cases, we had folks who had a gallbladder problem 15 years ago that had nothing to do with the sickness that they were now experiencing, but the insurance company said, you forgot to list that, and so we're going to drop you from your insurance. I met young people all across the country who, starting off in life, getting their first job, weren't getting health insurance and couldn't stay on their parents' policies. So the amount of vulnerability that was out there was horrendous. And what I said to myself and what I said to my team was, even as we were dealing with this big crisis, immediate crisis with respect to the economy, we've got to start doing something to make sure that ordinary folks who are feeling insecure because of health care costs, that they get some relief. So the reason we're here today is that thanks to outstanding work by people like Jim, thanks to outstanding implementation by folks like Kathleen, we are now actually able to provide some help to the American people. Essentially, part of the Affordable Care Act that we can implement right now and will take effect, is it today or tomorrow? Tomorrow. See, Francis knows. That will take effect tomorrow is the most important Patient's Bill of Rights that we've ever seen in our history. And let me just tick off some of the things that are going to be the case starting tomorrow. Number one, Paul already mentioned, the issue of lifetime limits. That is not going to be the rule anymore after tomorrow. If you've got a policy, you get sick, the insurance company covers you. Number two, pre-existing conditions for children. Children who have pre-existing conditions are going to be covered. Number three, we're going to make sure that if young people don't have health insurance through their employer, that they can stay on their parents' health insurance up to the age of 26, which is obviously a huge relief for a lot of parents who are seeing their young people just coming out of college and not being able to get insurance. You're going to be able to make sure that the insurance company doesn't drop you because of an innocent mistake on your insurance form. This rule of rescission, they are not going to be able to drop you arbitrarily, which gives you more security. Number four, you're going to be able to choose your doctor and not have to go through some network in an emergency situation as a consequence of these rules. So it gives customers more choice and more options. There's so many good things about this, I may have forgotten one. Kathleen, anything else? Right. And preventive care. I knew there was one more. Preventive care will now be offered under your policy, which over the long term can actually save people money because you get diagnosed quicker. So all these things are designed not to have government more involved in health care. They're designed to make sure that you have basic protections in your interactions with your insurance company, that you're getting what you paid for, that you have some basic measures of protection in interacting with the healthcare system, which means that you're not going to go bankrupt, you're not going to lose your house, if heaven forbid you end up having an accident, and you're able to get the quality care that you need. Now, obviously, there are a whole host of other things involved in the healthcare reforms that we initiated. Small businesses, 4 million of them, are going to get a huge tax break if they start providing health insurance to their employees. We've got measures that make sure that Medicare, the life of Medicare, is extended. And in fact, we just got a report today that the Medicare Advantage program that we have modified and scrutinized more carefully, that in fact rates are going to be lower for that than they were before. I just met with state insurance commissioners from all across the country. They are newly empowered to look after consumers. And I'll just give you one example. In North Carolina, in part because of the new leverage that insurance commissioners have, the insurance commissioner there was able to get a $125 million rebate for 200,000 customers in North Carolina, and they are seeing the lowest rate increases ever. All this is going to lower premiums. It's going to make health care more affordable. It's going to give you more security. That's the concept behind what we're implementing.